Welcome everyone, and thank you for joining us for today's webinar about two project opportunities that we are very excited to be offering here in New Hampshire to pediatric practices all over the state. My name is Holly Tutko, and I coordinate the New Hampshire Pediatric Improvement Partnership. I'm going to be talking about our first project on developmental screening, and my colleague Molly O'Neill will be talking about our second project opportunity starting at 12:45 regarding HPV immunizations. So just a few logistics for our webinar today. Everyone is currently on mute and in listen-only mode. If you have a question that you would like to submit, please use the chat box feature that is in the lower, probably right-hand corner of your screen today, and we will monitor that chat box to be able to respond to questions as we go and or at the end of this presentation. If you have questions about either one of these projects after these two webinar sessions, please feel free to contact Molly O'Neill. And her address, again, is Molly, M-O-L-L-Y, .O'Neill, O-N-E-I-L, @UNH.edu. If you have not received the participant packets that detail much more detail about both these project opportunities, you can find these on our New Hampshire PIP website at www.newhampshirepip.org. Thank you so much again for joining us, and we're going to go into describing our first project now on developmental screening. So we're excited to offer this first opportunity to help practices in implementing the American Academy of Pediatrics recommendations for developmental screening at the 9, 18, and 30-month well-child visits. This collaborative offering of the Citizens Health Initiative and the New Hampshire Pediatric Improvement Partnership is actually the second time that this project is going to be offered here in New Hampshire. Our first cohort was completed in July, and at the end of this presentation, we'll give you a couple of snippets in terms of the results of it that we're really excited about. So, what is this project trying to accomplish? What this project will help your practice with is implementation of the Ages and Stages questionnaire, a validated developmental screen that you will get support in helping your practices to integrate into your office workflow at the 9, 18, and 30-month well-child visits. So the where, we are currently recruiting for practices anywhere throughout the state. We have capacity to handle up to 5 pediatric and or family practice clinics. This next slide is a visual that represents the project in terms of what you can expect. The green center line details the project timeline. So the pre-work phase, which helps us with the planning and the baseline data collection needs, will be from February to March of 2016. April through December will be the actual active implementation phase for the project, and then post is time put in there for our staff here at the PIP to be able to analyze the results of the pilot and present those back to participating clinics in a conference call. So the activities in the boxes that are above the green timeline represent those activities and supports that are going to be offered to clinics through this project to be able to integrate mental screening. The activities that are below the green timeline are the evaluation activities that will support this measurement-based effort. So starting with the activities above the green line, what clinics can expect to happen in the first 2 months of the project is we will be, 1, hosting a webinar for clinicians about how to use the ASQ. we are planning to offer CME for this webinar opportunity. We will have 1 to 2 orientation calls with all of our clinics to be able to answer any questions, provide the detail needed in terms of making sure that both all clinics understand what will be happening, what supports that will be available to them, etc. We will also be doing a site visit where staff from the New Hampshire PIP will be coming out to your clinic to be able to do a few things. One is to be able to meet you folks and meet your team, see your clinics, so that we have a good understanding and relationship from the get-go of the project. This will also be a time where we'll be completing an office system survey that's noted by that pink box in the lower part of the timeline. This pre-survey allows us to identify what is currently happening in the office relative to developmental screening, so we can take that information in context in terms of the supports that we offer during the project. In addition, during the pre-work phase, practices will be completing a chart review, 20 charts from 3 ages that we'll be focusing on, the under 1s, the 1 to 2s, and then the 2 to 3s. To be able to help us assess your baseline implementation of developmental screening. In the actual intervention phase itself, again, going to the top above the green line in terms of the interventions activities, so these are the supports your clinic will be provided. You will have a session, 4 hours in person at the beginning during month 1, and then again at month 5 to help with both planning as well as getting into more detailed and more intricate cases in terms of implementing developmental screening and the resulting processes that need to happen after or if a child is flagged for a developmental screening failure or concern, excuse me. These in-person sessions are where you will bring your team, and we'll have each clinic develop a team of individuals which are outlined in the application packet to be able to work together over the course of this 9 months to be able to implement the developmental screening. So in the kickoff month, month 1, you'll have that in-person learning session. We'll have a call about a week after to answer any questions, see about progress and any immediate needs that you might have. And this month, in the gray box, your clinic team will have a 1-hour team meeting to assess what's working well, what's not working well, changes might need to be made to be able to implement in the beginning and then improve your rates of developmental screening. The orange boxes that are noted on our coaching visits. We will provide a coach to either come in person or virtually to be able to help your team with the nuts and bolts of integrating the developmental screening into your practice, as well as any questions you may have or help you may need. Okay. Now let's take a return back to the below the line activities. These are the evaluation activities they're going to be tracking. So you are going to be tracking 3 process measures and 4 outcome measures that are outlined in your packet to tell how well your office is doing or in terms of being able to ensure the screen is done at the designated visits, and then other outcomes that will help us determine the percent of population that has been screened to look at outcomes of over time. We're going to be tracking these measures via electronic health record uploads, so no more chart reviews from this point on. We'll work with your IT team to set up the fields, to help them set up the fields and the reports needed to be able to track your performance over time. They will be uploading this data to a data portal where you will be able to see real-time the results of your screening efforts by month. And I will go into a little bit more detail and show you an example of one of these in a few minutes. Finishing off the rest of our evaluation activities, each month the team leader will submit a very brief progress report that basically tells us about your cycle of change that you're currently doing and any help you may need, as well as helping us track attendance as we are planning to offer maintenance of certification credits. And then lastly, for the evaluation work, there will be a quick mid-process evaluation that will give us a check on how well we're doing in terms of the supports that we're providing you to give us time to change and address your needs better as needed in the latter course. And then lastly, in the post-intervention phase, you'll be completing that same pre-audit that you did of your office systems to be able to assess what current systems are in place now to be able to incorporate developmental screening. In our final moments, I wanted to present this chart. This is a chart demonstrating the results from our first cohort. This is looking at one of the measures, in particular, the percent of children who turned 1 in the past month who had 1 screen done within the past year. And this exemplifies 2 things. One, as you can see from our first cohort, we had significant in terms of the percent of children turning 1 screened, going from basically a sort of near 0 to upwards of 70% by the end of the project. 2, this gives you a visual explanation or visual to see what kind of data reporting you're going to be getting back real time through this online data portal that we'll be setting up. So lastly, just to outline some of the benefits of participating in this project, through this you'll have a way to be able to demonstrated ways to improve rates of developmental screening for the children served by your practice. You'll be getting tools, training, and technical assistance to help you along the way as you change your office workflow to be able to incorporate screening. You'll be receiving real-time reports that you can use on a monthly basis to be able to monitor and make changes to your efforts based upon the results you're seeing. You'll be able to communicate and learn from other practices. This is going to be done both through the bi-monthly conference calls that we're going to be offering, as well as through the learning seminars. And from our first cohort, we learned that this was something that practices really enjoyed and valued. Again, we're going to be offering up to 25 credits of Part 4 maintenance of certification credits through the American Board of Pediatrics, as well as CME for the webinar session. In addition, you'll also get the benefit of being able to bill for developmental screening, as developmental screening is reimbursed by all major payers in New Hampshire. And then finally, through this project, you're also going to get the ability to participate, if you choose, in other primary care practice building efforts, including the Northern New England Practice Transformation Network and the Behavioral Health Integration Learning Collaborative, 2 other projects of the Citizens Health Initiative. Lastly, just want to leave you with this quote from a clinic lead from our first cohort, which said, "Through this project, we're finally meeting the standard of care for developmental screening in our practice in a sustainable manner." So we thank you for this interest in this project. Again, if you want to learn more about it, please feel free to visit our website, www.newhampshirepip.org, and you'll find a developmental screening application description of the project and the application itself. And if you have any questions, we encourage you to email Molly O'Neill. Again, her email, molly.o'neill, O-N-E-I-L, @unh.edu. So without further ado, I'm going to turn the table over to Molly, who is going to describe next our HPV project.
Hi, everyone. Thank you for joining us today. I'm Molly O'Neill. I'm a research associate at the New Hampshire Pediatric Improvement Partnership. I'm going to be talking to you today about the HPV Immunization Project. This is a national initiative that the National Improvement Partnership Network and the Academic Pediatric Association are collaborating on. funded by the Centers for Disease Control and Prevention to improve adolescent human papillomavirus immunization rates nationwide. The New Hampshire Pediatric Improvement Partnership is happy to be offering this opportunity to New Hampshire practices to take part in this national immunization initiative. The project is led by our colleagues at the National Improvement Partnership, which is based out of the University of Vermont. So what is this project about? It's a quality improvement project that begins in February. There's a 3-month pre-work phase and then a 6-month implementation phase. The goal of the project is to increase HPV vaccination rates among adolescents ages 11 to 17 years old. Research shows that a strong provider recommendation is critical to patients' decision to vaccinate against HPV, and that missed opportunities contribute strongly to low HPV rates. This quality improvement project will assist you in practice level change to address those barriers, using quality improvement methods to help give strong provider recommendations and to reduce missed opportunities such as nursing visits and acute visits. So where is this project taking place? As I mentioned before, it's a national initiative. So this is the second cohort, and New Hampshire participated in the first cohort. The first cohort began in August and will be ending in April, and we had 3 practices participate in that. And we're hoping to recruit up to 10 practices, pediatric and or family practice clinics for the second cohort, which will begin in February and end in November. So how is this going to happen? This graphic here is basically the general project outline. You can find it on our website at nhpip.org. It's the graphic that's in the HPV immunization information packet that you should all have already received. So February is the enrollment phase. You will be getting a project overview, and you'll be establishing your practice team, which should include physicians, nurse practitioners, physician assistants, admin, office staff, nurses, and anyone else that you think would be important. March through April is your pre-intervention phase. This is when you're going to be completing, for evaluation purposes, your practice readiness assessment, an office systems inventory. You'll be participating in a project orientation and quality improvement training. These are all webinar-based, as I said, it's a national initiative. You will then also be submitting your baseline HPV vaccination rates. And you have 2 options of how to do this. One is to submit 30 reviews, or data for 30 chart reviews, or if you have an electronic health record and it has the ability to pull population-based data, you are allowed to submit that as well. Then you go into May through October, which is your implementation phase. So you'll participate in monthly team meetings to review your data. You will participate in monthly webinars, complete monthly PDSA self-assessments, and you'll do monthly chart reviews where you will do 16 charts each month. You will upload those and submit them through an online portal, and those are all practice-level data. And you will also complete a midpoint survey. Then in the wrap-up phase, which is November, you will complete your post-evaluation forms, which is your staff impact survey again, your office systems inventory again, and complete your post-HPV rates. You have to do that in the same way that you completed the pre-HPV rates. So if you did the EHR population-based data, you have to do that again in the post, or if you did the 30 chart reviews, you will have to do that again in the post. And again, more detail about this is located in the HPV information packet on our website. So some of the benefits for participating in this project are you have the ability to earn 25 credits of either American Board of Pediatric Maintenance of Certification or Maintenance of Certification for family physicians from the American Board of Family Medicine. You'll also receive QI coaching and support. You'll receive assistance in assessing your HPV vaccine delivery. You'll be able to have assistance in identifying barriers. You'll participate in those monthly learning collaborative webinars. Some topics for the webinars include delivering a strong provider recommendation for HPV vaccine and reducing missed opportunities for vaccination. You'll also be able to track your practice's progress through your monthly feedback reports. That's based on the data that you'll be submitting each month to the online data portal. And as I mentioned, this is the second cohort of this project. So the quote up top is by someone who has been participating in the first cohort. And she said, the webinars for this project have been top notch. I had my whole staff watch the webinar on strong provider recommendation. 2 of my nurses brought their daughters in for the HPV vaccine the next day. And I thought that was a strong recommendation for this project. So if you're interested in participating in either of these projects, the developmental screening project or the HPV immunization project, again, please contact me, Molly O'Neill, at molly.o'neill@unh.edu. And the deadlines for both of these projects, the developmental screening is February 5th, and the HPV immunization is January 29th. So just email me if you're interested and any questions, and I'll be happy to answer them. Thank you for coming today. And if you have any